Good morning, students. This is class 9 science chapter Why Do We Fall Ill? Students, in our last class, we have studied about the difference between health and diseases, then factors which affect our health, then what does the word disease free mean, then about acute and chronic diseases, infectious, that is communicable and non-communicable diseases, causes of diseases. Today we are going to study about the means of spreading infectious diseases. Means of spreading infectious diseases. So air, water, sexual and animal borne disease. We will study one by one. How does a disease spread through air? Some airborne diseases are common cold, influenza, measles, TB or tuberculosis. So how do these disease spread through air? You know, many infectious agents, especially those which affect the respiratory system of the person. Many infectious agents affect the respiratory system of a person and they are spread through air. When an infected person sneezes or coughs, whenever he sneezes or coughs without putting a handkerchief or a tissue on his mouth or in front of his nose, what happens? Many little droplets are thrown in the air. Many little droplets are thrown in the air. And these droplets contain a large number of disease-causing organisms, disease-causing the germs. And what happens if a healthy man breathes in this environment? He can catch the infection because this air has many of these microbes present in it. The microbes present in the droplets enter the body of the new person and make him diseased. So, spread of air transmitted diseases is more in areas which are crowded or poorly ventilated. Now, in the days of corona, you people are asked to maintain distance, to keep distance, not to, all these crowded places are like restaurants, gyms, they all are closed. Metros, they all are closed. Why? So as this disease does not spread through air. What happens? The microbes, when a person coughs or sneezes, the microbes present in his body comes out with the droplets of the sneezed or coughed part, and they enter the body of the new person and make him disease. And when we visit any overcrowded or poorly ventilated place, or if we are there, or a very crowded marketplace, or any hospital or any mall or any picture hall, then the chances of getting infected are very high. Persons living in such areas, poorly ventilated and overcrowded areas, are at a higher or greater risk. And the main diseases are common cold, influenza, then pneumonia and tuberculosis. Then comes the waterborne diseases or diseases which spread through water. You know, water is very important for all of us. Water is very common means of, it is very important. So it is also a very common means of spreading diseases. If we are not getting clean water, if we are not drinking clean water, chances of disease occurrence are very high. If we are not drinking clean water, chances of disease occurrence are very high. What happens when the excreta, that is urine and fecal waste of an infected person, are thrown near the water source? They get mixed with the drinking water and make the drinking water polluted. On drinking such water, microbes enter the body of new host. Microbes enter the body of new host. And the main diseases are cholera, dysentery, hepatitis, typhoid. These all are waterborne diseases. So we should always drink clean and purified water. Same thing happens with food articles, with food. Roadside food may be highly infectious. Insects and flies may carry the disease pathogens from the open excreta to the food articles and make them infected. So we should not eat roadside or open food which is exposed. When a healthy person takes such articles, he may get infected, and cholera, dysentery easily spread through eating this infected food. Then animal-borne diseases. Animal-borne diseases. Many disease, flies, mosquitoes, they are the carriers of many disease-causing germs. Some animals also carry the disease-causing microbes from one person to another. Such animals are known as vectors. Such animals are known as vectors. Mosquito are the important disease vectors. The female mosquito lays eggs, and so it requires highly nutritious diet. So it feeds on human blood, and due to their blood sucking habit, they can transmit microbes from infected person to a healthy person. Then this rabies also spread. Dogs are the carriers of rabies, and when an infected rabid animal scratches or bites a normal person, he may transfer the microbes into the healthy person. So animals and insects are also carriers of certain diseases. Then through physical contact or through sexual contact, many disease spread through physical contact also. Many when we come in direct contact with the infected person, or the items used by him such as towels, soaps, comb, clothes, what happens, these things of the infected person may not be used, because they may be carrying germs of the infected person, and when a healthy person use all these things, he may get infected. So we should try not to use, yeah, not to be in physical contact with with the diseased person. Then through sexual contact, AIDS, syphilis, these are the diseases which spread through sexual contact. You know what AIDS is? AIDS is acquired immunodeficiency syndrome. Acquired immunodeficiency syndrome. And sexual relationship with the infected person are highly risky. Contact with body fluids of such persons may result in a new infection. So we should be aware of all these things. Now, several types of diseases. Several types of diseases. We have studied about airborne diseases. They are caused by germs, bacteria, or virus in the air. And the examples are common colds, tuberculosis. Then foodborne diseases, they are caused by germs, bacteria, toxins, virus, fungus present in the food. And common examples are food poisoning, typhoid. Then waterborne diseases. Waterborne diseases is caused by drinking contaminated water, and amoebic dysentery, cholera, typhoid, they are common waterborne diseases. Then comes vector-borne diseases. They are caused by vectors or by animals that carry infectious persons from a sick person to healthy person. Example, malaria, dengue, COVID-19, fever. Then lifestyle diseases. Many diseases occur due to a poor or unhealthy lifestyle, such as heart diseases, diabetes. They all occur due to poor or unhealthy lifestyle. Then about the STDs, that are sexually transmitted diseases. STDs, sexually transmitted diseases, and they are caused due to sexual contact from one person to the other, and they are AIDS, syphilis, gonorrhea. All these are STDs. Where do these disease causing germs live in a body? Or we can say, where do these disease causing germs present in a body? There are a number of tissues and organs in a body where these microbes can get attached to. Generally, the point of entry decides where they will go. For instance, say any microbe that enters through the nose is likely to settle at the lungs. Microbe entering through our nose will most probably settle in the lungs. And this can also be seen through the signs and symptoms of a disease. Only through these organs and tissue issues seen affected with the microbe enter. But there's some other common diseases which are not tissue specific. So we will study about manifestation of diseases, means how do we know that we are diseased? How do we know that we are diseased? When we are diseased, we feel diseased. We are not comfortable. And certain signs begins to appear, such as body pain or headache or restlessness or cough and fever. And all these symptoms are known as symptoms of disease or disease manifestations. You know what happens? Headache, body pain, restlessness, cough, cold are very common symptoms which are associated with a wide variety of diseases. But there are other symptoms also which are disease specific, and they are known as specific symptoms. So some symptoms may be common symptoms and some symptoms may be specific symptoms. So we can say that the signs and the severity of the disease and its symptoms depend upon the number of microbes present in a body. The symptoms or the severity of the disease depend upon the number of microbes present in a body. So we can say that when our lungs are targeted, when our lungs are targeted, what are the symptoms? They are related to lung malfunctioning, such as breathlessness and coughing and sneezing and breathlessness and hypoxia, etc. Fear, yellowing of eye. Similarly, if the liver is affected, suppose if a liver is affected, what are the symptoms? The symptoms will be related to liver malfunctioning and jaundice and poor metabolism, yellowing of the eyes will appear. And suppose if the nervous system is affected, then we will be suffering from fever, headache, it all will appear. When the number is small, means when the microbes, when the disease causing agents are small in a body, the symptoms are minor or unnoticeable. But once these microbes multiply, but once these microbes multiply, the number becomes very high, and accordingly, the symptoms also become severe and life-threatening. And our immune system also acts as a major factor in determining the increase or decrease in the number of microbes in the body. If suppose our immune system is very strong, the number of microbes cannot become very high. But if we are having weak immune system, then these microbes will develop very quickly. So there are principles of treatment of these diseases. So what are these principles of treatment? Generally, two principles are involved in the treatment of infectious disease. The first is to reduce the effect of the disease by reducing or by stopping the effect of the disease. And the second is to kill the cause of the disease. We can kill the cause of the disease. How can we reduce or stop the effect of the disease? You see, the symptoms of the disease such as pain, fever are mainly because of inflammation. What is inflammation? A process carried out by immune system to stop or kill the microbes. So these symptoms can be reduced or we can minimize them by taking some medicine. Other symptoms, cough, sneezing, loose motions can also be reduced by taking some medicine, and by taking medicines to bring down the effects of these diseases, or we can take complete rest. If we rest, many diseases disappear when we take rest. Suppose we are suffering from common cold, so it will be there for 4 to 5 days, and without taking the medicine also we'll soon become better. But these all steps are to reduce the effect of the diseases. These all are to that we are taking general medicines to reduce suppose there is some swelling in a leg, so we can rub some Ardex or some release spray over there. And suppose we are having headache, so we can also use some types of spray or ointments and rest for a few hours, so it will be over. But the second principle of treatment is to kill the cause of the disease. To kill the cause of the disease. In this, we have to take suitable antibiotic or suitable drug which will kill the disease causing microbe. Killing the microbe is essential to treat the disease. See, symptom-based treatment can provide relief only for a short duration. Suppose we are having stomachache or loose stomach, then if we are using the, if we are reducing the effect, it will only last for a short duration because it does not kill the cause of the infectious agent. It is not killing the cause. It is not killing the E. coli, which is causing loose motion. So killing of microbes is essential to treat this disease. To kill the microbes, we can take certain chemical in the form of medicines. We can take certain chemicals in the form of medicine. These chemicals selectively act on the metabolic process of the microbe and kill them. Then each category of microbe or infectious agent has a different kind of metabolism. So one type of drug is effective only for one group of infectious agent because all these microbes have different kind of metabolism. So that one type of drug is effective only for one group of infectious agents. And I'll give you an example. For example, we have drugs called antibiotics. You know what are antibiotics? Anti means against, bi means life. So antibiotic, these drugs have been developed to block the metabolism of bacteria and protozoa. So these antibiotics will block the metabolism of only bacteria and protozoa. They are highly effective only if we have bacterial or protozoal infection. And these antibiotics cannot kill virus. So they are not effective against viral infection. Why? Because virus has a different kind of metabolism. And one more thing I like to tell you, making of antiviral medicine is very difficult. You all are aware that till date, 7 to 8 months have passed, or probably 10 months have passed, we are not able to make any vaccine or any drug for this COVID because making of antiviral medicine is very difficult. Why? Because virus have no cellular machinery. Virus do not have any cellular machinery. They have very few biochemical reactions of their own, and to target these reactions, it is a very difficult task. And due to this limitation only, we have very small number of antiviral diseases. So we'll stop here. I hope you have understood. We'll continue in the next class. In the next class, we will study about the principle of prevention of these diseases. The general principles of prevention. These were the principle of treatment. Now we'll study about the principles of prevention. Thank you and have a nice day.